Good evening, and welcome to Tele-Health Education for your Health Awareness Campaign Talk Series, the FAAP Initiative 2020-21. This is an inaugural virtual public health education program, which is an academic community partnership among the International Community Initiatives, the Maryland Rural Health Association, and the University of Maryland Eastern Shore School of Pharmacy and Health Professions. Welcome to the FAAP Initiative again. It is my privilege to serve as your host this evening. A little bit about our organizers and partner of the FAAP Initiative. Our missions are listed there for you. In the interest of time, I will not read our mission, but I would like to invite you to visit our website listed for more information about each of our partners. The mission of the FAAP Initiative is to promote healthy habits and raise health awareness through an interprofessional collaboration and telehealth delivery of health information for the community. The goal is to provide accurate health information, resources, and strategies based on selected health topics of the National Health Observance to promote health and prevent disease. This is a monthly 30-minute telehealth education episode delivered via YouTube channel by a variety of healthcare professionals for the public. For more information or to volunteer for this program, please contact myself or Ms. Laura Wilson, the Executive Director of the Maryland Rural Health Association. The following slides share with you the previous 3 episodes and remind you, if you're interested, please visit our ISI website to refer back to the previous month's episode. This month, we are very excited to have the topic of children's toy safety in celebration of Safety Toys and Celebration Month to be presented by Dr. Jackie Douge. The topic again today, children's toy safety, what we need to know to keep kids safe. It is my honor and privilege to introduce Dr. Jackie Douge, our speaker for this evening. Dr. Douge is a former director of Health Service Bureau at the Howard County Health Department in Columbia, Maryland, where she oversaw child health programs. She also served as a medical consultant for Howard County Public School System. Currently, she's a pediatrician at the Pediatric Center of Frederick. She has also served as the American Academy of Pediatrics Public Health Special Interest Group co-chair and a past president of the Maryland Public Health Association. Please help me welcome Dr. Douge.
Thank you for the opportunity to present this evening. So as Dr. Trong mentioned, my name is Dr. Jacqueline Douge, and today I'm going to talk with you about children's toy safety. And this is the outline for the discussion today. I'll provide an introduction with some data about toy-related injuries, leading causes of injury in children related to toys, how we can prevent injuries, and additional resources, and then we'll just summarize the presentation for this evening. So, as I'm a parent and a pediatrician, so I know how much kids love toys, and even as an adult kid, like I like to refer to myself, I enjoy playing with toys. But for our kids, that especially this time of month as well, being December and the holiday season, as we're looking to buy toys for kids, as much as we want that, we're excited for them to play with them, we also want to be mindful that as fun as toys can be, there also can be a risk with toys. We want our kids to be able to play safely with the toys that they buy for them. So this is data from 2018 from the United States Consumer Product Safety Commission. As you can see, thousands of children are injured each year due to toy-related injuries. In 2018, over 200,000 children were treated in the emergency room because of toy-related injuries. The good news, though, is that most kids who are treated have so there's not a cause of death. The kids are released from the emergency room. But these accidents and injuries related to kids can be fatal, but most of them are not. When we look at gender differences, boys tend to have a higher percentage of toy-related injuries compared to girls. And the most common affected area of the body tends to be the head and face area. So I wanted to provide some data about what are the leading causes of toy-related injuries by gender. There's some commonalities between both females and males. The leading toys that cause the most injuries for both groups are either a scooter, a non-motorized scooter, or a skateboard, followed by balls, toy vehicles, and building sets. Overall, the leading cause of injuries in children in 2018 happened to be non-motorized scooters. And again, this slide just underscores what toys tend to cause the most accidents. Skateboards are related in approximately 1 in 3 toy-related emergency room injuries, and scooters are related in approximately 1 in 5 toy-related injuries for females. This slide really illustrates which children, what age range of kids tend to be higher at risk for toy-related injuries, and also illustrates that as kids age, the toy-related injuries decline. For both males and females, the highest age group risk tends to be in the 1 to 4 age range. And then as you can see, as children get older, both males and females, the percentages of toy-related injuries decline with age. Most common toy-related injuries, again, tend to be lacerations, contusions, fractures, strains, sprains, internal injuries, and maybe foreign body. So most kids, these are treatable conditions. So now that we know the prevalence of injuries in children, let's talk about how can we actually prevent these injuries. Over the next few slides, I'm going to go over some tips and strategies. So before you're going to buy a toy, once you have the toy, how do you prevent injuries? So before you buy toys, it's important that you really select toys that are age appropriate. Also match the interest and skill level of your children. You want to look for quality design and construction of the toys. So, a harder plastic versus a thinner plastic, which might break easily. Okay, so you want to find a better constructed toy. You want to make sure that all the directions or instructions are clear to you and when appropriate to the child. I know myself from personal experiences buying toys for my children were smaller. There were many times I think I didn't understand the directions and wish I had this information when they were younger to know to buy toys and the instructions were clear. In addition, you want to discard plastic wrapping on toys, which potentially could be a choking hazard for children. And also be mindful of the labels of the toys. You want to make sure that, again, you follow the age recommendations. If it says not recommended for under 3, that's probably not a toy that would be appropriate for that age range. You also want to look for safety labels. Does the label say that it's flame retardant or flame resistant? Washable stuffed toys or dolls that are washable make it easier for kids to play with those toys. So how do you prevent injuries once you do have the toys? So what you want to do is you want to definitely check the toys periodically for any breakage or potential hazards. I showed this illustration of these wooden blocks because wooden toys, over time, the edges can become sharp or covered with splinters, and those can injure children. So be mindful that those edges need to be sanded smooth to reduce injury for children. And also outdoor toys, you want to check them regularly, looking for weak parts or rust that can become a danger for children. And another important strategy is storing toys away. So we want to make sure that we talk to our children about putting toys safely away on shelves or in toy chests so that we prevent trips and falls, not only for the child, but also for a parent. Again, as a parent, and maybe you all can relate to this. There have been many times when my kids have left their toys on the floor, and inadvertently, as a parent, you actually step on a Lego, or you happen to step on their favorite toy truck, and not only do you fall, but you may break the toy, and your child may not be happy about that. But it's important that they learn to store toys. And even when they store toys away in toy chests, that's also an area to also be mindful of for safety as well. Making sure that the toy chest, the lid doesn't close in on their hands, or maybe just having an open toy chest versus one with a lid, so to prevent some unintended injuries. The next few slides, I wanted to go over some safety precautions for preventing specific related accidents related to toys. So what are some tips for preventing choking? So ideally, when you have a toddler or a small child, you want to make sure that they're not small toys or parts. One recommendation is to buy a toy that's larger than the child's mouth, so that you really decrease the risk of them putting things in their mouth and swallowing them and then possibly choking on them. Again, you want to make sure that the toy is sturdy and there are no small parts that can break off. Also, you don't allow your children to play with latex balloons, because again, that's a choking hazard. And again, you want to check toys as well, marbles. And I know for me, being a pediatrician in the office, I've had a few patients already who have swallowed magnets or swallowed marbles, or even small metal balls. So again, you want to be very mindful of the risk of some of the toys. When it comes to beanbag chairs that contain small foam pellets, that's also a word of caution, because kids can either choke or inhale on those pellets. Toys that have arrows or darts can also be a choking hazard when it's entered into a child's mouth. So some more pointers regarding preventing falls or drowning. Riding toys should be kept away from stairs, traffic, and water. And it's very important as parents that we be mindful that we supervise children while playing on these toys, and making sure that the toys fit properly on the toy. Preventing suffocation and strangulation. I talked about earlier the importance of, even when you're buying a toy and unwrapping it, that the plastic wrapping get thrown away and discarded fairly quickly, because again, it can become a suffocation hazard to small children. Avoiding toys with strings or cords that can wrap around the child's neck, that can cause suffocation and strangulation. And this also is pertinent to clothing that children wear, because again, the strings from hoodies that children might wear could get tangled and become a strangulation hazard. And then preventing injuries from loud noises. Ideally, you want to avoid toys with noise levels that are higher than 100 decibels, because this can damage your child's hearing. So now I just want to go over some resources that I think are important for parents to be aware of, parents or guardians or even grandparents. The Consumer Product and Safety Commission website, they have a treasure of information for parents. They have reports on unsafe toys, and also it's a place for parents to learn about toy recall. So if you have a question or concern about a toy that your child has, or you're thinking about buying as a gift, or you have a friend, I think this is important to share the information. So I've provided the hotline number to either report a toy you think is unsafe, or even going to the website so you can see if there are any recalls on the toys that your kids have or your friends' kids may have. And additional resources, childproofing steps. So safekids.org is a great resource for parents as well as professionals. And the photo on the right-hand side is an infographic about childproofing. Again, safety tips, toy safety tips, some additional toy safety tips. And then from the American Academy of Pediatrics, healthychildren.org, there's a wonderful 2-page handout. It's also available in Spanish on how to buy safe toys. And then last but not least, as pediatricians, we're always available, nurse practitioners, any pediatric provider. We're more than willing to talk to parents and guardians about how they can keep their children safe, how parents can keep their children safe. And so in summary, toys are fun for kids, but we want to keep them safe. Most childhood toy-related injuries do not cause death. Toy-related injuries decrease as children age, but they are preventable. And there are resources available to you to assist with learning more about choosing safe toys and keeping your kids safe. Thank you for the opportunity to present with you this evening.
Thank you, Dr. Douge, for sharing with an informative presentation along with resources that may help parents. With that, we will conclude the session for this evening. We thank you for joining the FACTS Initiative, and we wish you and your family and your children a happy and safe holiday season. Stay tuned for the next episode to be announced on our website for January 2021. Have a good evening.